Welcome back, everyone. Today, we're taking a deep dive into a topic that's probably on the mind of anyone who's serious about strength training, pain.
Definitely an important one. It's something we all encounter at some point.
Our guide for this exploration is Rebuilding Milo by Dr. Aaron Horschig. And what's interesting about this book, at least from what I've read so far,
It's a good one.
is that it shifts the focus from simply masking pain, popping a pill or slapping on a heating pad,
Right.
to really comprehending its origins. And then, of course, how we can tackle those root causes directly.
It's really empowering. I mean, instead of just passively accepting treatments, athletes can become proactive participants in their own recovery, which is huge.
Absolutely, and I think that's a theme we'll see recurring throughout this deep dive. So get ready, because today we're going to uncover some real game-changing insights. We'll explore how even elite athletes grapple with pain,
I don't think most people realize that.
and how understanding your body's mechanics can be the key to unlocking not only enhanced performance, but also long-lasting athletic longevity.
Both. Gotta have both.
Gotta have both, exactly. Right off the bat, Dr. Horschig introduces us to this fascinating story, the story of Milo of Croton, the ancient Greek wrestler.
Ah, Milo. A classic example.
So, for those who might not be familiar, this guy, he gradually increased the weight he carried every single day
Like every day.
until ultimately he became incredibly strong, like legend status. What I'm curious about, though, is how does Dr. Horschig tie this ancient tale into the modern world of strength training?
Well, it's a brilliant analogy, actually. The Milo story perfectly illustrates that fundamental principle of progressive overload, which is like the cornerstone of strength training.
Right,
So just as Milo couldn't just leap from carrying like a little calf to carrying a full-grown bull,
right.
we need to, in our training, progressively increase the load, the stress that we're putting on our bodies.
That makes total sense. We can't just jump into the deep end, right? We got to ease ourselves in, let our bodies adapt.
Exactly. It's about consistency, gradual progression over time.
So it's like building a house. We need that solid foundation before we start adding those extra floors.
100%.
But what happens, though, when we ignore those signals our bodies are sending us and we push too hard too fast? Because let's be real, we've all been there.
Well, Dr. Horsig doesn't shy away from that reality. In fact, he shares a pretty sobering story, the cautionary tale of powerlifter Josiah O'Brien.
Oh, I remember reading about him.
Yeah, so during a competition, Josiah experienced a life-threatening aortic dissection,
Wow.
which is incredibly serious. It really highlights the potential consequences of ignoring those warning signs our bodies give us and just pushing past our limits.
Yeah, it's a stark reminder that we need to respect those limits, listen to what our bodies are telling us. And speaking of listening to our bodies, the book then dives deep into some common pain points for strength athletes. And of course, it starts with
Well, it has to, right?
back pain.
The most common,
Seems like back pain is
almost like a rite of passage.
almost a universal experience for anyone who lifts, wouldn't you say?
I'd say so. I mean, it's incredibly prevalent in the strength training community.
So why is that? Why does back pain seem to plague so many of us who are into strength training?
Well, the book challenges those traditional medical approaches, the ones that often just revolve around painkillers or, in more extreme cases, surgery.
Right.
Rebuilding Milo takes a different approach, advocating for a deeper understanding of how the spine actually works.
Mechanics of
The
it.
mechanics of it, yeah. And it stresses the importance of cultivating genuine core stability as the foundation for addressing those root causes of back pain.
And that's where this concept of the neutral spine comes in, right? Can you explain what that means and why it's so crucial for us lifters?
Think of the neutral spine as that sweet spot for your spine.
That happy place.
Yeah, that happy place, exactly. It's that optimal zone where the load, the weight you're lifting, is distributed evenly across your spinal discs and vertebrae. So when we venture outside of this neutral zone, particularly when we're lifting heavy,
Yeah.
the risk of injury, it skyrockets.
So maintaining that neutral spine, it's like building a house with a solid foundation, right? It can withstand a lot more stress.
That's a great analogy. And Dr. Horschig, he draws upon the work of who's probably the leading authority on spinal mechanics, Stuart McGill.
Oh yeah, I've heard of him.
McGill's research emphasizes the vital role of core stability for safe and powerful movement, which is what we all want, right?
Absolutely. So how does this all actually connect to the experience of back pain? How do these injuries happen?
Well, the book, it gets into the nitty-gritty, the mechanics of various spinal injuries. So, for instance, you've got disc bulges, which happen when the inner core of a disc, it kind of pushes out through the outer layer. And this often happens because of too much spinal flexion, especially when you're under a heavy load.
I could see how that would happen.
Then you've got facet joint injuries. So those are the little joints that connect the vertebrae.
Right.
And they can get irritated or inflamed from repetitive strain or even those tiny, like unnoticed traumas that accumulate over time.
Yeah, those little things.
those little things that you might not even realize are happening. And then there's spondylolysis, which is basically a stress fracture.
A stress fracture. Ouch.
Yeah, in a vertebra. And that's frequently aggravated by excessive spinal extension. So like too much arching of the back.
Wow, it sounds like there's so many ways things can go wrong.
There are. That is.
But I appreciate how Dr. Horschig provides that framework for understanding these injuries. I'm particularly intrigued by this kinesiopathologic model, or KPM, that he talks about. It seems like a detective's approach to pain.
Right, it is. It really is. It's all about identifying the specific movement or posture that's actually causing the pain instead of just focusing on the anatomical structures themselves. So instead of just saying, oh, my back hurts,
Right, like,
we need to become investigators of our own bodies and figure out what am I doing that's making it hurt.
what's that trigger, right?
Exactly. It's all about identifying those triggers. And the book offers guidance on how to do that.
That's great.
How to recognize those specific movements and postures, both in your training and even in your daily life, that are triggering your back pain.
It sounds like self-awareness is key here.
It's huge. And Dr. Horschig, he even introduces these two terms, flexion intolerance and load intolerance,
Okay.
which are super helpful categories for pinpointing what's going on.
And I imagine recognizing whether you have one or the other, or maybe even both, can lead to a much more personalized approach to dealing with that back pain, right?
Absolutely. It's about understanding your individual needs and tailoring your approach accordingly.
So tell me more about these self-tests the book mentions. How can we actually pinpoint those triggers?
He's got a bunch of them, actually. Some simple self-assessments you can do, like there's the heel drop test,
Okay,
there's the single leg squat analysis, which is a great one.
I like that one.
Yeah, so these are designed to like really pinpoint your individual pain triggers. And he also encourages exploring whether your discomfort is triggered by, certain spinal movements like bending forward or twisting,
Yeah, or even just
or simply by how much weight you're
the
lifting.
amount of weight.
Exactly.
So recognizing whether you have that flexion intolerance or that load intolerance is key.
It helps you determine which movements to avoid or modify
So you can train safely.
and which weights are appropriate for you at that particular time.
This is already so insightful, but once we've identified those triggers, then what? How do we go about building that essential core stability to protect our backs?
This is where things get really interesting. Rebuilding Milo challenges this widespread misconception
It's a big one.
that having a six-pack, like those washboard abs, automatically equals core stability. It's just not true.
Right. So many people think that.
So many people think that. But true core stability, it's about developing endurance in those muscles that actually stabilize your spine.
Not just,
It's not just about having defined abs. It's about function, not just aesthetics.
it's about what's happening on the inside, not just what it looks like on the outside. I'm starting to think those endless crunches I've been doing
Oh, the crunches.
might not be the answer after all.
Well, Dr. Horschig, he highlights what are known as McGill's Big Three exercises.
Okay.
These are the curl up, the side plank, and the bird dog. So these target core stability endurance in a variety of different planes of motion. And he even presents a modified curl up, which is a much safer alternative
Safer than the traditional crunch.
to those traditional crunches.
Yeah.
And a lot of people do because it minimizes that spinal flexion, that rounding of the back.
Right.
And it also reduces the overuse of those hip flexors, which can be a problem with traditional crunches.
Wow, this is already so eye-opening. We've just scratched the surface of back pain, and I'm already rethinking my entire approach to core training. But we've got so much more ground to cover.
We do.
Hip pain, knee pain, and that complex beast, shoulder pain. We'll delve into those in our next segment.
I'm looking forward to it. All right, so now that we've kind of laid that groundwork with back pain and that all-important core stability, I think it's time we shift our focus a bit down to the hips.
The hips. Another area that seems to cause so much trouble for us lifters.
It really is. And just like with back pain, rebuilding Milo takes a slightly different approach, a more movement-based approach to understanding and addressing hip pain.
So I've heard Dr. Horschig really emphasizes looking beyond just anatomical diagnoses. Why is that so important when we're talking about hip pain specifically?
Well, he encourages us to move beyond just slapping on those simplistic labels, like groin strain or hip flexor issue. We need to go deeper and really delve into how our individual movement patterns might be contributing to pain in that whole hip region.
It's not just about the structure, it's about how we're actually using it.
Exactly. It's about function because Pain in that area can originate from so many different sources. A narrow, kind of anatomy-based diagnosis might not capture the full picture.
So it's not enough to just say, oh, I pulled my groin. We need to ask ourselves, well, how was I moving? What was I doing that might have led to that strain in the first place? What are some specific examples of hip injuries that Dr. Horschig covers in the book?
He goes into a whole range of them, common ones like groin strains, those tears in the adductor muscles, which those are a real pain for athletes, especially those involved in sports with lots of explosive lateral movements.
Right.
Then you've got hip flexor strains and tendinopathy, which those are super relevant for activities with like lots of repetitive hip flexion, things like running and cycling.
And I'm assuming he also addresses those dreaded labral tears,
Oh,
those
absolutely.
injuries to the cartilage rim of the hip socket.
Yeah, those are tough. He covers those as well, especially because those are often associated with, repetitive pivoting or twisting motions,
Right.
which we might encounter in certain lifts.
Especially in strength training.
Exactly. But remember, Dr. Hoshig's main emphasis is on identifying those dysfunctional movement patterns.
Not just the anatomical diagnosis.
Right. So it's not just about labeling the injury, but really understanding how our movements might be contributing to it.
So how does he go about actually screening for hip pain? What does that process entail?
Well, he lays out a really comprehensive assessment process in the book, and it starts with observing how someone squats, their squat mechanics. So he analyzes both double and single leg squats to kind of evaluate how well an athlete is controlling movement at that hip joint.
That makes sense. The squat is such a fundamental movement in strength training.
It really is. It's a cornerstone.
So what else is involved in his screening process?
He also uses specific mobility tests like the modified Thomas test, which is great for uncovering any tightness in those hip flexors. And he'll also use palpation, which is basically just using his hands to feel for any restrictions or like pain points in the muscles and soft tissues around the hip.
So he's combining visual observation with like a hands-on approach to get a more complete understanding of what's going on.
Yeah, it's about gathering as much information as possible.
So once he's identified those restrictions or those pain points, what does he recommend for actually addressing them?
He's a big proponent of addressing mobility issues,
Makes sense.
both at the ankle and at the hip, because those can both influence how well you squat. So, for example, if you have limited ankle dorsiflexion, which is the ability to bring your toes up towards your shin,
Right.
it can actually make it harder to maintain an upright torso during a squat, which can then put more stress on the hips.
Right. And potentially even the lower back.
Exactly. It all comes back to that interconnectedness of the body that we were talking about earlier.
It's all connected. So what specific techniques does he suggest for actually improving mobility in those areas?
He suggests a multifaceted approach, so a combination of different things. He likes using foam rolling to release tension in the muscles and fascia.
Foam rolling, the classic.
Yeah, it's a good one.
It's got to be in there.
He also recommends joint mobilizations to kind of improve the actual range of motion at the joint itself. And then, of course, targeted stretching to address those specific restrictions he's found.
So it's not a one-size-fits-all solution. It's about tailoring the treatment to the individual's specific needs.
Exactly. It's about individualization, meeting people where they're at.
Out of all of Dr. Horschig's insights on hip pain, what stands out to you as particularly insightful or maybe even surprising?
I think his emphasis on the gluteus medius and minimus, those muscles are often overlooked,
They are.
but they're crucial for stabilizing the hip and controlling how the knee moves. When those muscles are weak, it can lead to all sorts of problems, like you get that knee valgus, that inward collapse of the knees that we see so often.
Right, that knock-kneed look.
Yeah, exactly. And it can also lead to pain, not just in the hip itself, but even in the back.
Wow, so it's not just about the hips. It's about how the hips influence the rest of the body.
Exactly. Weakness in one area can have this ripple effect.
And that interconnectedness, it becomes even more apparent when we start exploring Dr. Horschig's approach to knee pain, which, let's be honest, is another issue that plagues so many strength athletes.
It really is another common one.
And he shares a pretty striking statistic in the book. 51% of weightlifters reported experiencing chronic knee pain.
That's a lot.
And yet, get this, 95% of them continued training through it.
It's that no pain, no gain mentality.
Yeah, athletes often feel this pressure to just push through the pain, even though, as we've already discussed, pain is often a signal that something needs to change.
Right. It's not weak to listen to those signals. It's actually like the smart thing to do.
It's about respecting your body, not viewing pain as something to be conquered. So how does Dr. Horschig approach those common causes of knee pain? How does he categorize them?
Well, he addresses those typical diagnoses like patellofemoral pain syndrome or PFPS, which is basically pain around the kneecap.
Right. super common. And then,
out of band syndrome.
and of course,
Yeah. And tendinopathy, both patellar and quad tendinopathy. But as with back pain and hip pain, his focus is really on understanding those movement dysfunctions that contribute to these conditions.
it's not just about the diagnosis, it's about the why behind it.
Exactly. It's about figuring out the root cause.
So let's break up down a little bit. What insights does he offer on PFPS, that pain around the kneecap that seems so common?
He really emphasizes the importance of knee stability, particularly rotational control, in preventing PFPS. So if your knee wobbles or collapses inward during movements like squats,
Right, it kind of caves in,
it can put uneven stress on that patellofemoral joint,
leading to pain.
which can, over time, lead to pain and damage.
And I'm guessing that lack of hip stability we were just talking about could contribute to those knee problems as well, right? Seems like it all ties together.
You're exactly right. If those gluteus medius and minimus muscles aren't doing their job stabilizing the hip, it can absolutely lead to that inward knee collapse and increase the risk of PFTS.
What about IT band syndrome? Does he offer any new perspectives on that? Because it seems like it's often misunderstood.
Yeah, he does. He actually challenges that conventional wisdom that IT band pain is all about friction. He argues that it's more likely due to compression of those tissues underneath the band, and he links that compression to, you guessed it, poor knee stability, that inward knee collapse we've been talking about.
So again, it circles back to the importance of knee stability and addressing those underlying movement patterns.
Exactly. It's about looking at the bigger picture.
Let's move on to tendinopathy, specifically patellar and quad tendinopathy, which can be incredibly frustrating for athletes because it tends to linger and makes it hard to train consistently. What does Dr. Horsford have to say about that?
He provides a really clear explanation of what tendinopathy actually is, differentiating between reactive tendinopathy and reactive on degeneration.
Okay, so what's the difference?
So reactive tendinopathy is like a acute response to overload. So you do too much too soon,
You push it too hard.
and your tendon gets angry. Reactive on degeneration, on the other hand, happens when a tendon that's already undergone some degeneration, some wear and tear over time.
It's already a little bit damaged.
Exactly. And then it's subjected to further overload.
So it's like adding insult to injury.
Exactly. And that distinction is important because it helps determine the best course of treatment.
So someone who's been pushing through pain for a long time, their tendon might be more vulnerable to further injury.
Exactly. And it's important to take that into account when designing a rehab program.
So does his approach to treating tendinopathy revolve around strengthening the tendon?
Absolutely. He's a firm believer in exercise as the most effective treatment for tendinopathy, not injections or passive therapies. He recommends a phased approach, starting with isometric exercises, where you're basically contracting the muscle without actually moving the joint.
Isometrics are great because they're usually well tolerated, even when other exercises might irritate the tendon.
Right. And then as the tendon starts to feel better, he progresses to isotonic exercises, which involve both concentric and eccentric muscle contractions. He's a big advocate for what he calls heavy slow resistance training, which basically means using controlled movements with heavier weights to gradually build up the tendon's capacity.
So it's about systematically increasing the tendon's ability to handle load without breaking down.
Exactly. It's about building resilience.
What's the key message he wants athletes to remember when it comes to tendinopathy?
Patience. This is a process that takes time.
It's not a quick fix.
You can't rush it. Trying to jump back into your previous training intensity too soon can actually re-injure the tendon and set you back even further.
So it's about playing the long game, respecting the healing process.
Exactly. It's an investment in your long-term athletic health.
This has been incredibly enlightening, and we've covered so much ground already, but of course we still have that complex beast, the shoulder, to tackle, and that deserves its own deep dive. All right, let's tackle that final frontier of pain for strength athletes, the shoulder, that intricate, often troublesome shoulder. It seems like shoulder pain is practically a rite of passage in the world of lifting.
It's definitely up there with back pain in terms of how common it is, and it's no wonder, really.
The shoulder is such a complex joint.
It is remarkably mobile, but that mobility comes at a cost. It makes it inherently more susceptible to injury, especially when we're pushing it to its limits with strength training.
I love how Dr. Horsig describes it in the book. He compares the shoulder joint to a golf ball perched precariously on a tee.
That's a great analogy. Designed for a wide range of motion, but that very design compromises its inherent stability.
Exactly. So it's this delicate balance between mobility and stability, and he does a fantastic job of breaking down the interplay of static and dynamic forces that are at work within the shoulder joint.
It's a fascinating interplay, and it's crucial to understand both aspects if we want to keep our shoulders healthy.
Just as a refresher, can you remind us what he means by static and dynamic forces?
Sure, so static forces come from structures like the ligaments, the joint capsule, and the labrum. Those provide passive stability, meaning they're always there providing support. Then you have dynamic forces, and those are generated by the muscles surrounding the shoulder, primarily the rotator cuff. Those contribute active stability, meaning they have to be actively engaged to do their job.
So it's like this constant dance between those passive restraints and the active muscle control. What happens when that equilibrium is disrupted? Is that when we start seeing those common shoulder pain issues popping up?
That's exactly when those villains make their appearance. Impingement, rotator cuff injuries, labral tears, those are the usual suspects. And Dr. Horschig does a really good job of breaking each of those down, explaining what's happening mechanically and how movement dysfunction can contribute to those conditions developing.
Let's start with impingement, because I think that's something almost every lifter has experienced at some point. It almost feels like an inevitable part of the journey.
It is very common, and Dr. Horschig actually makes an important distinction between primary and secondary impingement.
Okay, so what's the difference?
Primary impingement happens when there's an actual structural narrowing of the space between the rotator cuff tendons and the bone above them. That's often due to things like bone spurs or anatomical variations.
So it's like there's physically less space in there.
Right. Now, secondary impingement, that's a little different. It stems from dynamic instability. That means the head of the humerus, the upper arm bone, isn't gliding smoothly in the socket, and that causes pinching of the surrounding tissues.
So with secondary impingement, the issue is more about movement dysfunction than an actual structural problem.
Exactly. And he really emphasizes how weakness or imbalances in those muscles that control the scapula, your shoulder blade, can contribute to that dynamic instability.
The scapula, it seems like it plays a much bigger role than we often realize.
It's a crucial player. If it's not moving properly, it can throw off the entire mechanics of the shoulder joint.
And then, of course, we have rotator cuff injuries, which can range from tendinitis, the inflammation of the tendons, to actual tears in the muscles or tendons themselves.
Right, it's a spectrum. And again, he emphasizes that faulty movement patterns, especially during overhead lifting, can significantly increase the risk of those injuries.
We talked a lot about how Dr. Orshik prioritizes technique. What are some of the most common technical flaws he sees in overhead lifting that contribute to shoulder pain?
One of the biggest culprits is limited thoracic spine mobility. If your mid-back is stiff, it limits how well your shoulder can move overhead. So you end up compensating in ways that put more stress on the joint.
It's not just about having strong shoulders, it's about having that mobile thoracic spine as well.
It all works together. He also points out how important scapular control is. If your shoulder blade isn't moving properly, in sync with your arm, during those overhead movements, it can lead to impingement and instability.
And finally, let's talk about labral tears, because I know those could be particularly challenging to rehab.
They definitely can be. They often require a longer recovery period because the labrum, that cartilage rim of the shoulder socket, it doesn't have a great lipid supply, so it heals slowly.
So what typically causes a labral tear?
It can happen from a sudden traumatic injury like a fall or a direct blow to the shoulder, but it can also develop gradually over time from repetitive microtrauma, especially with repetitive overhead movements.
So we've covered some of those common culprits behind shoulder pain. How does Dr. Horschig approach assessing shoulder function? What does his screening process look like?
His approach is very thorough. He takes into account range of motion, rotator cuff strength, scapular control, and he'll try to identify specific movements that trigger pain. He's really looking for the why behind the pain, not just the what.
It sounds very consistent with his approach to back pain, hip pain, and knee pain. It's about understanding the individual's movement patterns and pinpointing those specific dysfunctions that are contributing to their discomfort.
It's all connected, and he uses a variety of techniques during his screening process. He'll assess range of motion, looking for any limitations or asymmetries. He'll check the strength of those rotator cuff muscles, especially the external rotators, which tend to be weak in people with shoulder pain. He'll watch how the scapula moves during arm elevation, looking for things like winging or excessive shrugging. And of course, he'll palpate the muscles and soft tissues around the shoulder, feeling for any tender points or restrictions.
It's a very holistic assessment, looking at the whole system, not just the shoulder in isolation. What about his recommendations for actually addressing shoulder pain? What are some of the key strategies he highlights in rebuilding Milo?
He really stresses the importance of restoring thoracic spine mobility. He'll often recommend exercises like the prayer stretch, the box T-spine stretch, and the quadruped rotation stretch to improve extension and rotation in the mid-back.
Makes sense given how often we see those thoracic spine limitations in people with shoulder pain.
He also advocates for soft tissue mobilization to release tension in those muscles surrounding the shoulder. The peps, the lats, the biceps, those are often culprits. He suggests using foam rollers and small balls for targeted release of those muscles.
And I'm assuming strengthening the rotator cuff and improving scapular control are also key components of his approach.
Absolutely. He includes a wide variety of exercises that target those areas, and he'll progress those exercises from basic to more challenging variations as the individual strength and stability improve.
Well, this has been an incredible deep dive into rebuilding Milo. It's packed with so much valuable information for anyone who wants to understand and overcome pain in strength training. As we wrap up, what's the one key takeaway you want our listeners to remember?
I think the most important message is that pain is information. It's our body's way of telling us that something needs to change. By understanding the mechanics of our bodies and addressing those root causes of pain, we can not only conquer those aches and limitations, but we can also unlock greater performance and longevity in our training. It's about working with our bodies, not against them.
Beautifully said. And we definitely encourage everyone to check out the full book, Rebuilding Milo, for more detailed guidance and specific exercises. Remember, sustainable progress in strength training comes from understanding your body and heeding its signals. Don't let pain derail you from achieving your goals. Learn to listen to it and address those root causes. Thanks for joining us on this deep dive. We'll catch you next time.